Next question is, which diagnostic test is used to evaluate kidney function by measuring the glomerular filtration rate? Options are blood urea nitrogen, serum creatinine, creatinine clearance test, urine analysis. Blood urea nitrogen, that is BUN, usually measures nitrogen levels in the blood. Then serum creatinine, it indicates kidney function but does not directly measures glomerular filtration rate. Then creatinine clearance test measures the rate at which creatinine is cleared from the blood by the kidneys, that provides an estimate of glomerular filtration rate. Then urine analysis, it evaluates urine for any abnormalities like presence of protein, glucose, or any presence of infections, but it does not measures glomerular filtration rate. Hence, the correct answer is creatinine clearance test. Creatinine clearance test is used to evaluate kidney function by measuring glomerular filtration rate. Next question is, the presence of which of the following in a urine analysis indicates infection? Options are ketones, nitrates, uric acid, glucose. Ketones in urine are typically seen in uncontrolled diabetes, not an sign of infection. Then nitrates, the presence of nitrates in urine is a strong indicator of bacterial infection, especially gram-negative bacteria like E. coli. Then uric acid in urine is usually associated with gout or kidney stones, not the infection. Then glucose in urine can indicate uncontrolled diabetes, but it is not a direct sign of infections. Hence, the correct answer is nitrates. The presence of nitrates in urine indicates presence of infection. Next question is, what is the primary action of diuretics in the treatment of hypertension? Options are increase reabsorption of sodium, promote excretion of sodium and water, decrease glomerular filtration, increase production of aldosterone. Increase reabsorption of increase reabsorption of sodium, first option. Diuretics decreased sodium reabsorption to help reduce fluid retention, which lowers blood pressure. Then second option, that is promote excretion of sodium and water. Diuretics work by increasing the excretion of sodium and water, reducing blood volume and lowering blood pressure. Then third option, that is decrease glomerular filtration. Diuretics do not primarily affect glomerular filtration, but they target the kidneys to enhance fluid excretion. Then increase the production of aldosterone. Diuretics generally work by decreasing aldosterone or blocking its production or its effects to promote fluid loss. Hence, here the correct answer is diuretics promote excretion of sodium and water. That is the primary function of diuretics. Next question is, which intervention is most important when caring for a patient with a Foley catheter? Options are keep the collection bag above bladder level, encourage the patient to drink less water, maintain a closed drainage system, change the catheter daily. First option, that is keep the collection bag above bladder level. Keeping the collection bag above the bladder level can cause backflow of urine, which increases the risk of infection. Hence, the collection bag should be kept below the bladder level. Then second option they have given, encourage the patient to drink less water. Reducing fluid intake is not recommended. Adequate hydration is important to prevent infection and maintain kidney function. Then maintain a closed drainage system. Keeping the catheter and drainage system sealed and closed helps prevent the introduction of bacteria and that reduces the risk of urinary tract infections. Then fourth option, change the catheter daily. Catheters are usually changed when they are necessary. That means when there is infection or blockage, they are not changed on daily basis. Hence here the correct answer is maintain a closed drainage system. Next question is, in which condition is continuous bladder irrigation commonly used? Options are ureteral stone removal, post-transurethral resection of the prostate, chronic pyelonephritis, renal failure. Ureteral stone removal. Continuous bladder irrigation is not usually used after ureteral stone removal. It is more focused on preventing clot formation or infection. Then post-transurethral resection of the prostate. Continuous bladder irrigation is often used after transurethral resection of the prostate to flush out blood clots and debris from the bladder after surgery. In chronic pyelonephritis, continuous bladder irrigation is not commonly used for chronic pyelonephritis, which involves kidney inflammation and infection. Then renal failure, continuous bladder irrigation is not a primary treatment for renal failure. Other interventions such as dialysis are commonly used. Here, the correct answer is post transurethral resection of the prostate. Next question is, which electrolyte imbalance is most common in chronic kidney disease, that is CKD? Options are hypokalemia, hyperkalemia, hyponatremia, hypercalcemia. What is hypokalemia? Hypokalemia refers to low potassium levels. They are not typically seen in CKD. Hyperkalemia is more common due to impaired renal excretion. Then hyperkalemia, that is high potassium levels, they are common and dangerous complications of CKD due to kidneys reduced ability to excrete potassium. Then hyponatremia, it refers to low sodium levels that can occur in CKD but are less common than hyperkalemia. Then hypercalcemia, these are elevated calcium levels are not primarily features of CKD. Hypocalcemia is more typical due to impaired calcium metabolism. Hence, the correct answer is hyperkalemia. Next question is, what is the normal range for serum creatinine in an adult? Options are 0.5 to 1.5 mg per deciliter, 1.5 to 2.5 mg per deciliter, 2.5 to 3.5 mg per deciliter, then 3.5 to 4.5 mg per deciliter. First option, that is 0.5 to 1.5 mg per deciliter. This is the typical normal range for serum creatinine levels in adults. That indicates normal kidney function. Then 1.5 to 2.5 mg per deciliter. This range indicates mild kidney disinfection as creatinine levels are elevated above normal level. Normal level is, that is 1.5 mg per deciliter. Then third option is 2.5 to 3.5 mg per deciliter. Elevated creatinine in this range typically indicates moderate to severe kidney dysfunction. Then 3.5 to 4.5 mg per deciliter suggests significant kidney impairment or failure of kidney. Hence, the correct answer is 0.5 to 1.5 mg per deciliter. That is the normal range for serum creatinine in adults.